In the United States today, millions of people don't have access to satisfactory mental health care. 55% of U.S. counties don't have a single psychiatrist, psychologist, or social worker available. Those folks who are able to access the system too often find that their practitioners and programs don't share their health information efficiently, making the experience more frustrating and less helpful. And even the best psychiatric medicines available today can carry difficult side effects and often don't address some of the patient's most important challenges for recovery, namely challenges with cognition, motivation, and social function. Fortunately, the rapidly growing field of digital therapeutics shows great promise to address these issues. IMRO, One Mind Institute, has been a leader in funding this field since 1995, when it was founded.
Yeah, that was 1995, so I was 23. I don't remember it all that well. I wasn't doing that well back then. You know, I was diagnosed with schizophrenia about 5 years before that, and I was still pretty symptomatic and not very socially well-adjusted, in part due to chronic isolation that I had from the disease. But thank God I got good treatment. I went to UCSF, put me on some good medications that worked well. It got me back on track, and then I actually saw a scientist, Sofia Vinogradov. She was piloting a program for cognitive training for schizophrenia, where there are these targeted exercises done on a computer that can strengthen the parts of the brain which are weakened in schizophrenia. And it worked for me pretty well. I was able to get more socially adept, understand conversations better, remember what was being said better, be more fluent in speaking back with people, and I was able to get a lot more social after that and resume work and start to develop more friendships again, and it was great. So that part of what we funded has helped me a lot.
The brain is continually changing itself as we acquire ability. We call this neuroplasticity. We know that targeted progressive cognitive training can have a very big impact on a person's ability in their operations in everyday life. All of these strategies show promise in helping individuals with psychiatric struggles, and IMRO has been a major leader in contributing to research in this neuroplasticity domain.
The idea basically is there are maybe 4,000 or 5,000 different apps on the market now, software and apps that claim to be treatments for mental illness. Some of them are fantastically researched, very carefully designed. Others are made by individual people in their garage. And so there's no requirement for these things to be tested in clinical trials, and they're not regulated by any government agency like the FDA for drugs. Patients would come to me, they would say, how do we know if any of these things are good? So the idea was, why don't we start sort of a consumer reports type of effort, a website, and we will list these products, we will describe them, we will describe the evidence base behind them, we will have experts review them, and we will create a portal so that consumers can go on and rate and comment, just like on Amazon.com if you want to rate a book. And we will combine all these sources of data to produce a number that ranks the products and their quality so that people can make an informed decision.
We are currently raising funds to continue the efforts of PsyberGuide and to expand them. First, we would like to develop a more complete list of apps that are potentially useful. Right now, we rate 80 out of 3,000 available apps. We'd like to really cover the field more systematically. Secondly, we would like to be able to have sufficient funding to actually do some clinical testing of some apps to find out how effective they really are in helping people remain stable. Thirdly, we're considering also raising funds to develop apps ourselves. In collaboration with academic investigators, we can make apps that we think would really be perfect and fill the gap for some of the things that people need. We are also exploring whether we can develop apps that more easily integrate with electronic records. That's a really important piece to bring together the various parts of the mental health system, especially for people with more severe forms of illness. These are the top priorities that we are seeking funds for to continue the efforts of PsyberGuide.
PsyberGuide provides a very valuable service for mental health consumers. I invite you to learn more at PsyberGuide.org.